Hi pregnant moms, this is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger and OBGYN physician. So today I want to talk about twins, and the question is, are twins a high-risk pregnancy? Do you have to go to a specialist, or can your midwife deliver the twins, or your regular OB, or your family practice doc? Well, the question becomes what type of twins. If you have identical twins, meaning that they're both in one sac, it is definitely a high-risk pregnancy because the babies are sharing one sac and their cords could get wrapped up and this could present problems. The other thing you have to worry about with identical twins when you're pregnant is that one could get very big and the other one could get very small, and the one that gets very small could become very sick and possibly even die. So these are the things that we worry about if you are having identical twins, and definitely yes, you need to see a high-risk doctor, also known as a maternal fetal medicine specialist. But let's talk about twins who are not identical, also called fraternal twins. Do you need to see a high-risk doctor when you're pregnant with twins that are not identical? And my answer is yes, even if it's just for a consultation. And let me tell you why. When you're having twins, or even higher multiples, triplets, quadruplets, certainly anything higher than twins, you definitely need to see the high-risk doctor. But if you're having twins and they're not identical, you could still have problems, especially early labor, because there are two babies sharing this one uterus that's getting stretched to the max, and when the uterus is stretched, sometimes it gets irritated and you start having contractions. So one of the problems with twins is that you can go into labor too soon. That is a reason to be followed by a high-risk doctor. The other thing you have to worry about with twins is that there is a higher situation of having stillbirths. We're not really sure why. Certainly if you have infections on board, that is a possibility. So twins, although they are not fraternal, and even if you are seeing a midwife or an OB or a family practitioner, at least once during your pregnancy, you should be seen by a high-risk doctor for, if no other reason, for them to do what's called a level 3 ultrasound. It's more specialized, where they can really make sure that the babies are growing properly. And the other recommendation that I would have, not just to moms who are pregnant with twins, but to all pregnant women, please stop drinking soda, because when you drink soda, your chances of having a urinary tract infection are greater. And if you have a urinary tract infection, also known as a UTI, then the uterus becomes irritated and you could potentially go into labor too soon. So drinking soda is a risk factor for early labor. Having twins is a risk factor for early labor. And if you drink soda and if you have twins, then you are definitely increasing your chances of having your babies too soon. So I hope this information has been helpful to you, and if you want more helpful information like this, then please get a copy of The Smart Mother's Guide to a Better Pregnancy at www.smartmothersguide.com, which is my website. You can either get an ebook or you can get a regular book at a discount. And if you read the book, then you will be in a better position, because even if your doctor or your midwife misses a potential problem with your pregnancy, you won't. Until next time, this is Dr. Linda Burke-Galloway reminding you that a healthy pregnancy doesn't just happen. It truly takes a smart mom who knows what to do.